You know, I don't really call this time of the year a great time for weight loss, you know, with all that food that's around, sweets just at our fingertips, but still, we all do want to lose weight, right? Sometimes diets don't work, and we often might think about benefits of weight loss surgery. Well, we're on your side, speaking with Dr. Andrew Frey with Advanced Surgeons. He's in studio now to talk about this. How you doing?
Doing well. Thanks for having me.
Well, I first want to ask you, when we talk about weight loss surgery, can you kind of take us through, without getting too graphic, what that procedure is actually?
Sure. There's a variety of procedures. I would say the most common are restrictive procedures or malabsorptive procedures. That could be a sleeve gastrectomy or a gastric bypass. Those would be two most common.
Okay. I think a lot of us have heard of the gastric bypass surgery.
Sure.
So what are the benefits of having this type of procedure?
So currently, you know, obesity is probably the second most common preventable death in America, okay? And so patients have linked comorbidities, whether it's high blood pressure, high cholesterol, diabetes, sleep apnea, even cardiovascular disease, all linked to the obesity, okay? If you can treat that, you can get resolution or improvement in all of those. That leads to a better quality of life, longer life.
Yeah. And some might be saying, though, we know of weight loss medications that are out there,
Sure.
and yet still the possibility of the weight loss surgery. Why would you do that over the medications?
Sure. I would say over the past few years, those medications have really taken off. You'd expect to see maybe 15% weight loss with the medications alone, okay? Surgery is about 2 to 3 times greater weight loss than those medications. But you have to look at the individual patient. Not every patient is a surgery candidate. Not every patient is gonna have the same benefits. So really, you have to individualize it to the patient.
You undergo this process and it can help, but you still have to maintain a certain lifestyle, do you not?
That's right. So these are tools. The medications tools, the surgery would be a tool. And it's a lifestyle change. And it comes with diet, it comes with exercise. It's not the surgery alone or the medication alone.
Yeah. When you see this, though, and you're a surgeon or you work with a patient on this, and you see the results that they see and you get instant reaction maybe a few months down the line, what is that like and what do you see in there?
Yeah. There's phenomenal change, whether it's things they didn't even think about, from putting their shoes on to walking to the desk at work. Big changes with relatively, you know, nobody wants to undergo surgery, sure, but it's well tolerated. It's typically a night in the hospital to have just a profound change in the rest of your life. And so it's great. It's a great, fulfilling pathway and career.
Sure, and we're just touching the tip of the iceberg when we're talking about this topic. If people want to get some additional information, because I'm sure that's what you say, let's do the research first. Where do they go?
Right. Well, we have a couple avenues. We have online seminars where people can gain more information, or we have in-person seminars where you can come, ask questions, and find out everything you need to know.
Yeah, very good. And Dr. Andrew Frey with the Advanced Surgeons. Thank you so much for joining us.
Thanks for
having us. Good stuff right there, yeah. Something for everybody to think about, and we've got something for you to think about as well. More news right after the break. You're watching WBRC, Fox 6 News.